Hello, I'm Dr. Charlene Thorburn, also known as Dr. T. I'm a doctor of chiropractic, also a registered nurse. Today I want to talk to you about carpal tunnel syndrome. We've heard a lot about carpal tunnel syndrome and a lot of people have it, but a lot of people do not know what it is. So basically what carpal tunnel syndrome is a change in the wrist causing pressure on a nerve, affecting the person's ability to feel and move their hand and be strong in that area. Carpal tunnel comes usually from repetitive use of the hand and the wrist, especially in the wrong position. People are on computers all day long, cell phones, etc., and that's not the right position for the hand. This is a correct position for the hand and the wrist. A lot of people use tools and they're twisting and doing things very strongly all the time. Grocery checkers move groceries along, and all these repetitive type of motions can create problems in the wrist. So carpal tunnel is a change in the tunnel that exists in your wrist. If you were to remove my hand right now, there'd be this oval space here, which I'm going to draw for you. So we have the wrist, kind of looks like that. And at the top, we have bones. And they're called carpal bones. That's why it's called carpal tunnel. There's a tunnel created in here between bones and a strong ligament that holds all the bones together. Between here is the space, the carpal tunnel, and in here pass nerve, blood vessels, artery, and some other things in there. As long as this space stays large, there's no pressure on the blood vessels, the nerve, anything else, and your wrists are fine. But what we see happen very commonly is one of these bones drops down, which makes the space in here smaller. There are other reasons for carpal tunnel, but the most common one we see is this bone dropping down. So what happens is when that space gets smaller, your nerve, which is very sensitive, now has pressure on it and it stops functioning correctly. And one of the first symptoms of pressure on the nerve is a little bit of tingling. The next thing that happens can be pain and numbness. And after that, a person can start to get weakness in their hand. So this nerve that gets affected is called the median nerve, and it affects your thumb, index finger, middle finger, half of the ring finger, and this much of your palm. And it also goes over the tips a little bit. So when people start to get numbness and tingling in these areas, we know that there's pressure on the nerve because the nerve comes up and into the hand at that area. So when I was a nurse and people had carpal tunnel, one of the first things they did was inject a steroid. And steroids go in and actually destroy 25% of the tissue in the area. So if you have, a small space and you just destroy 25% of the tissue, it starts to get better, but it doesn't last very long. The next thing they would do is go in and actually cut either partially or fully this ligament down here. This ligament's very, very strong, like gristle on a steak, and it stabilizes the area. But when you cut it, you open the area up, but now you have a less stable wrist. So that's not an ideal thing because 50% of those surgeries fail within 18 months. So it's not a proven effective treatment. So what we do in our office is we just move that bone up. Sounds simple, but we literally do a little procedure in the wrist and lift that bone back up here so it's no longer putting pressure on the nerve. In addition to that, we also do some exercises. We talk about positioning. Sometimes people have to use a little brace for a while. We work on the muscles in the area. And a lot of times we also have to work with nutrition and anti-inflammatories to get a full, complete result on the patient. So that's what we do for carpal tunnel. It is a resolvable problem, and I hope this helped you. Thanks for watching.